Cryptosporidiosis. Cryptosporidiosis is a gastrointestinal coccidian protozoan, Cryptosporidium. The thick-walled oocyst is the inactive form of Cryptosporidium. Oocysts can survive in a myriad of environmental conditions. Transmission is caused by ingestion of fecally contaminated water and/or food. Examples include water swallowed while swimming, by exposure to contaminated fomites, and the fecal-oral route from person to person. Crypto is one of the leading waterborne diseases in the world. The first human case of cryptosporidiosis was recorded in 1976 in Tennessee. Infection of C. parvum is more likely to affect infants, children in daycare settings, those drinking unfiltered or untreated water, those involved in farming practices, travelers to areas with untreated water, living in densely populated urban areas, and engaging in sexual practices that would bring a person into oral contact with infected feces. Bottled water is at risk of spreading an infection if it is not from a source that is pasteurized or distilled. Those companies using surface water, examples lakes and rivers, have the same risk of cryptosporidiosis as tap water from the same source unless additional treatment is implemented. In 1993, in Milwaukee, Wisconsin, 403,000 people were affected by a waterborne outbreak. In a 2-year follow-up study, of the 54 crypto-related deaths in Milwaukee area, 85% were AIDS cases. In immunocompetent individuals, cryptosporidiosis is a self-limiting, acute diarrhea illness. Usually, symptoms will last 1 to 2 weeks. These symptoms include frequent watery diarrhea, vomiting, low-grade fever, abdominal cramps, and nausea. A victim can be infected even after symptoms have subsided. Therefore, they are still able to transmit the disease. In persons who are immunocompromised, extraintestinal infection can occur, accompanied by site-specific symptoms such as pancreatitis, pulmonary infection, cholangitis, hepatitis, and conjunctivitis. Pulmonary cryptosporidiosis symptoms include coughing, croup, wheezing, shortness of breath, and hoarseness. Diagnosis is usually conducted by recognizing the parasite in microscopic examination of infected feces. If a person is suspected of having cryptosporidiosis, the health practitioner should specify a request for a cryptosporidium test. Most labs do not perform the necessary tests needed to identify this routinely. Unfortunately, there is no specific reliable curative treatment for cryptosporidiosis available at this time. Dehydration is a major concern in any gastrointestinal tract disorder, so management of fluids and electrolytes is essential. Non-specific antidiarrheal medicines may provide temporary relief. Most treatment plans emphasize rest and replenishment of fluids. An over-the-counter probiotic called Saccharomyces boulardii, brand name Florister in the U.S., has been found to be a natural treatment for managing diarrhea caused by cryptosporidium and other infectious agents. As for any infectious disease, massage is contraindicated. Only after complete recovery with permission from a healthcare provider are patients indicated for massage. Laboratory studies show that cryptosporidium oocytes are resistant to chlorine, Sidex, and Lysol. According to the EPA, water can be filtered by either reverse osmosis or by boiling the water for 1 minute. In summary, be careful when swimming in surface water.
Bueno, respecto a